Hi, and welcome to the ToxFox, a central hub for all things toxicology. My name is Anastasia, and I'm an emergency medicine resident in California. This episode is all about mushrooms. Learning about mushrooms is like learning a whole new language, especially when they're called things like Gyromitra esculenta. Nobody coming out of medical school wants to learn more words, so I've come up with the 3-2-1 rule to learn about the big, bad, and scary mushrooms that you'll see in the emergency room. But first, a montage of all things mushrooms. There are 10,000 species of mushrooms in the world. Only about 100 of these species are toxic. When talking about the anatomy of a mushroom, we talk about the cap, the gills, the veil, the stem, and the cup. These parts help mycologists identify the type of mushroom that you bring us, even though most of the time we aren't able to identify them. A good rule of thumb is if you develop symptoms like nausea, vomiting, and diarrhea within the first 6 hours after ingestion, it's less likely that you ingested something that'll kill you. However, there are always exceptions to the rule, and you should really know what you're gathering before you decide to eat it. So let's get to that 3-2-1 rule. 3 mushrooms that affect the brain, 2 that affect the kidneys, and 1 mushroom to rule them all and kill your liver. Our first brain mushroom is Gyromitra esculenta, also called the false morel. This is not to confuse you with the true morel, which is what fancy people eat in restaurants. The toxin is called gyrometrin. It inhibits GABA, which is an inhibitory neurotransmitter in the brain. It's no surprise that these patients present to us with seizures from all of the excitatory neurotransmission. Onset of symptoms is usually greater than 6 hours with GI symptoms. However, you can also see things like methemoglobinemia and destruction of red blood cells. Treatment is largely supportive. You can give methylene blue if you suspect methemoglobinemia, or you can order blood if you suspect destruction of red blood cells. Another treatment is called pyridoxine, which is essentially vitamin B6. The dose of that would be 25 mg per kg IV over 30 minutes, and you can repeat that to a max of 20 grams. Our second brain mushroom is Amanita muscaria, which is a mushroom that most of us know about from playing Mario Kart. The 2 toxins are ibotenic acid, which is a potent insecticide, as well as muscimol, which is a hallucinogen. You actually have to eat a lot of this mushroom in order to see the toxic effects, which is why this mushroom is frequently sought after for its hallucinogenic effects. In many parts of the world, it's actually considered to be a food, and not always listed in the guidebooks as something that's toxic. However, in the US, it is considered to be a toxic mushroom. Onset of symptoms is 30 to 90 minutes after ingestion with an alcohol-like intoxication. The patients will be confused, a little bit dizzy, but you can also see things such as psychosis and seizures. Treatment is largely supportive, but you can consider benzos for severe agitation. The third brain mushroom is the psilocybin mushroom. Now let's be real, this is the mushroom that most millennials are interested in. The toxin is psilocybin and is similar to LSD and serotonin. Onset of action is between 30 and 90 minutes after ingestion of a couple of caps and usually lasts about 6 hours. Most patients describe distortions in time and space, visual and auditory hallucinations, as well as panic attacks. Treatment is again largely supportive, and you can consider giving benzos for agitation, Tylenol for hyperthermia, as well as standard medications for seizure. If you go onto Wikipedia, it actually says that the places that have currently decriminalized psilocybin include the entire state of Oregon, Denver, Colorado, Oakland, California, and Santa Cruz, California. Now that we've talked about the 3 brain mushrooms, let's move on to the 2 kidney mushrooms. The first kidney mushroom is called the Cortinarius mushroom. The toxin is called arelinin. The way that this mushroom causes kidney damage is it causes interstitial nephritis and tubular necrosis. Patients will present greater than 36 hours after an ingestion with nonspecific GI symptoms. Within a week, they'll usually develop flank pain and have decreased urine output. Unfortunately, there's not any kind of treatment that we can really give them. However, you can consider hemodialysis. Fun fact, the author of the book The Horse Whisperer, which I'll be honest with you, I've never actually heard about. I don't know if that makes me a cultural caveman, but the author ingested Cortinarius mushrooms and actually had to get a kidney transplant. The second kidney mushroom is called Amanita smithiana. This mushroom grows from British Columbia all the way to Northern California. The toxin is called alenic norleucine, and the mechanism of action is not well known. Again, there's not really an antidote. Patients present a little bit earlier than the Cortinarius mushroom group, with GI symptoms within 6 to 8 hours post-ingestion and renal failure within 1 to 3 days. So now it's time to talk about that one liver mushroom, Amanita phalloides. This is a mushroom that's responsible for almost 90% of mushroom deaths in the Western world. The toxin is called amatoxin and inhibits polymerase II. Onset of symptoms is usually 6 to 8 hours post-ingestion with nonspecific GI symptoms. You'll get nausea, you'll get vomiting, you'll get colicky abdominal pain. Between 12 and 24 hours, that's where you're going to see most of your hepatotoxicity and a decrease in your GI symptoms. Your AST and your ALT will rise, which is a measure of liver function. After 24 hours, most of your organs are going to shut down. You're going to have renal failure, you're going to have liver failure, you're going to have cardiomyopathy, encephalopathy, anything that ends in opathy. Unfortunately, there's not really any good cures for this. You can consider giving N-acetylcysteine, which is the treatment for Tylenol overdose. You can consider things like penicillin G or even silibinin, but ultimately this patient needs a liver transplant. Now that we've gone over all of the mushrooms, let's recap the 3-2-1 rule. 3 mushrooms that affect the brain. These are Gyromitra esculenta, which causes seizures and can be treated with vitamin B6, Amanita muscaria, which is the mushroom seen in Mario Kart and causes hallucinations, and the psilocybin mushrooms, which are now legalized in several places. The 2 mushrooms that affect the kidneys are called the Cortinarius mushrooms and Amanita smithiana, and the 1 mushroom that affects the liver is the Amanita phalloides mushroom. Hopefully that helps you get through your next shift. Thanks for watching the Tox Fox.